All right, Jeff, you are on, my man.
Good afternoon, everyone. Again, I'm Jeff Sarazan. I'm an optometrist here in Wausau in Vision Eye Care. I have somebody with me today here as well. I've got Chloe Bainbridge. She's a fourth-year optometry student. So she was in high school until 2014, went to undergraduate school, then to optometry school. She's finishing up her last year, and she's spending a semester at my office. I like to joke that she's training me, all right? Because new students are exceptionally smart these days. Everybody's doing good? Yeah? Having a good year at school? It's tough to sit in the classroom, the weather's nice, right? It's even tougher to be at work. There's a lot of things to keep you outside today. But thanks for hanging out. We're going to talk a little bit about optometry and what it is and what I do for a living. I don't want this to be me just standing here for an hour going blah, 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 blah. I'd like to make this a little bit interactive. It's going to be very casual. If you have questions, let me know as we move along, okay? Anybody know what an optometrist is? Anybody been to an optometrist? Yeah.
Eye doctor, right?
Yeah, very good. She's the first eye doctor. Right back there in the block. Okay, cool. So yeah, optometrist, eye doctor. The eye is such a specialized organ that we need doctors just for the eyeballs, all right? That's what I do. I spend my day looking at eyeballs, all right? We have people come in that need glasses or contact lenses. We take care of that. We have people that need to be treated for pink eye. We take care of that. We also treat the structures around the eye. So let's talk a little bit about that. We're going to try to move through a few slides here. Doctor of optometry really comes from the two words, meaning optos and metrics, which is to measure the eye, although that's quite a simplified version of what we do during the day. Here's a much better definition of what we do, and this is from the American Optometric Association. So doctors of optometry, primary health care specialists for the eye. We examine, diagnose, treat, and manage diseases, injuries, disorders of the visual system, the eye, and associated structures, such as the eyelid. Yesterday we had a lady in the office that had some skin tags on her eyelid that were quite bothersome, and Dr. Chloe here was kind enough to remove those for her. So that would be associated structures. Also, we identify systemic conditions that affect the eye, all right? Anybody in this room diabetic? No? Okay, but you know people who are, maybe dad, mom, grandpa, and grandma. Diabetes is the #1 cause of new adult blindness. So if you see somebody who's legally blind, maybe they're walking with a cane, chances are it's from diabetes. So as optometrists, we spend a lot of time looking at the eye to make sure it's healthy and making sure that they're not having problems from there, things like diabetes or high blood pressure. What do we do during the day? We prescribe medicines. Dr. Chloe and I have a patient coming in at 2:30 today who has some very red, itchy eyes. We're going to prescribe some medicine for her, probably a topical eye drop like a steroid or an antibiotic. Low vision rehabilitation. What that is, I am not a low vision specialist, but some optometrists are. And a person that has really, really bad vision, they might be legally blind but still can see just maybe a little bit, would perhaps use something like this. It's a pair of spectacles, probably from the 1930s, mounted with a little telescope on there. So they can look through that and perhaps see the television when they're sitting in their lazy boy. I'll pass this around. You guys can take a look at those. And I'm sure I'll get those back. Nobody wants those. Vision therapy. Again, yesterday Dr. Chloe and I had the most interesting case. We had a 7-year-old. Yeah, 7. He was complaining of blurred vision at about 4 feet, which is really weird because usually people complain about blurred vision here or they can't see far away. But his complaint was 4 feet. He said people's faces are fuzzy when he looks at them. So we went and examined the young man, and he actually had a little bit of strabismus. His eyes were turning out, all right? So when he was trying to look at something, he wasn't able to fuse the images, and he was describing that as being blurry. So Dr. Chloe and I talked to his mom about some vision therapy, which is basically just some eye exercises to try to strengthen the eyes. Those can be very rewarding. As an optometrist, we're also prescribing glasses, contact lenses, and we do some minor surgical procedures like We talked about the skin tags yesterday. Occasionally we'll have somebody that'll have a piece of metal in their eye, and we'll come in and remove that. But we're not doing, you know, cataract surgery or LASIK surgery or anything like that.
Jeff, for that therapy for that 7-year-old,
Yeah.
how long would that have to take for things to straighten out for him?
Yeah, so I'm gonna see him back in 4 months, and we should see a
Okay.
little bit of improvement, but
Okay.
it's gonna take a couple of years.
Wow.
Yeah. With kiddos, if you catch that stuff before age 7, they do great. After about age 7, there's not a whole lot you can do. So vision therapy for 18 or 19-year-old doesn't do a whole lot. So that's why we wanna see kids early. He gets an eyeball for us.
Yes, I do.
All right, so those of you that have been to the eye doctor, this is kind of what you see, right? You walk in, and here I am, I've got somebody behind the phoropter, we're showing them some different lenses, kind of asking them which one looks more clear. That's kind of what you think of when you think of the eye doctor, or going to the eye doctor. A lot of times we'll prescribe medicines. I must say, I've had this slide for a number of years. I always review them every year before I come in. I was looking at this one last night. I noticed I must have been doing something besides optometry because my thumb was smashed. That's the first time I've noticed that.
Hey, our screen's working, it appears, so if you wanna press the arrows up there,
Oh, look at that.
try that again, just touch the screen, see what happens. There,
Forward, up, down.
and then forward, up, down, yeah. Hey!
Look at that. It's so
It hasn't worked all year. You have the magic touch, I
I
think.
do, yeah. A lot of the day we spend determining whether people need glasses or contact lenses. But in my opinion, the most important part of the eye exam is to making sure the eye is healthy. And this is what we're doing here. We're doing the eye health exam. So I've got Kim here in the slit lamp, and I've got a lens I'm holding up to her eye to look into the back of the eye. We see a lot of cool things come in the office, really on a daily basis. And I'm going to put a few slides through here. I didn't want to make them too gross, but I want to show you some of the things that might walk in on a daily basis. I mean, how cool is that, right? Like such a little fat there. Anybody wear contact lenses? Okay. Dailies, monthly, 2 week? Monthlies. How often do you replace them?
Month and a half usually.
Okay. That's usually what everybody says. How about you guys?
Dailies,
You replace them daily? Yeah.
2 weeks.
Yeah. And you replace them monthly?
Yeah.
Yeah, okay. So I'm a big fan of daily disposable lenses for a lot of reasons. This is an example of somebody who had their monthly lenses worn for a month and a half. And if you flip over their eyelid, this is what it looks like underneath. It looks pretty beat up and pretty sore. And these people will usually say that their contact lenses are not comfortable anymore. The lenses are sliding around, they're kind of blurry. And that's because they're wearing these lenses that are dirty a little bit too long, and it really irritates the upper lid like that. We used to see a ton of this, but the whole contact lens industry is kind of switching to daily lenses. And so we're seeing less and less of this as people move into the daily lenses. Subconjunctival hemorrhage. This is something that looks a lot worse than what it is. This is basically just a broken blood vessel in the eye. It's usually from trauma, but not always. Sometimes they happen just spontaneously. And you can see there's quite a pooling of blood in this area. These usually just go away in 2 weeks, and we just kind of monitor them.
Jeff, going back to that orbital fat, what causes that?
You know, it's just a herniation of the fat. It just happens spontaneously. It's not from an injury, anything like that. That's actually very, very rare.
Okay.
I bet you Dr. Chloe's never seen that. I've seen it a couple times in 30 years.
Huh.
Yeah, it's just one of those things that was so cool, I take a picture of it. A laceration is not good, all right? So you can see right here what's going on. You guys are 16, 17, 18? Yeah, it's hard to talk to this age and tell you how important it is to wear safety glasses, because you all think you're invincible. But you need to try to wear safety glasses when you're doing stuff around the home. If you're mowing lawn, even something simple like working with a bungee cord. I mean, stuff happens so fast. And you don't want to lose an eye. I mean, granted, you have 2 of them, but it's kind of nice to keep your eyesight. So try to think about wearing safety glasses whenever you can. They're cheap, they're easy to throw on. I see patients from 10 days old to, we saw somebody that was 90 yesterday. Kids are fun. You know, it can be a little bit intimidating to have something like this come in and need an eye exam. I can tell you if I've got a 10-day-old on the schedule, Dr. Chloe's not going to be the first one to jump out of the chair and say, I got this. Because kids are tough. They really are, especially 3-year-olds, because they try to kick you. All right. What do you guys see here that doesn't look right? I know you don't know what these words are, so I can just show you the pictures.
The irises will be
Look at that. Yeah, excellent. So, if we see a newborn with different colored irises, it can either be just congenital, like David Bowie. You guys don't know who David Bowie is, you're too young. Or it can be due to one of these eyes being something like congenital glaucoma. So if we have a newborn with different colored eyes, they need to be evaluated by an eye doctor, right? And it turned out this was just something that was genetic and it was of no concern. You know, we have a lot of fun at work. You know, it's not all business, it's not all serious. Being an optometrist is a lot of fun. I mean, in the middle of the day, you're busy, and this kid comes in for an eye exam, he's wearing this. Oh, what the heck? That's just, you gotta laugh, right? That's why this career is really, really, really enjoyable.
Until you see what I wear next week when I come in.
Yeah, right? Yeah, I'm off that day. That's why I introduced you to Dr. Chloe today. What do you think ptosis is? By the way, it's not ptosis, it's silent. It's ptosis, okay? What's going on here? What do you guys see? Yeah, it looks like swelling, the droopy eyelid. So this child has one eyelid that's droopy compared to this one. Again, it can be congenital. It can be a brain tumor. All right, so there's a lot of things you need to look at when you see something like this. Yes, optometrists tend to be nerds. I got a really funny story for you guys. 15 years ago, I had to go to a convention, and the directions were pretty specific. When you get to LAX, the airport, get off the plane, go to the green transom area, and get on the shuttle bus. I get there, and I couldn't find my group, and I look, there's 15 people standing in a row staring at their feet. I thought, those are my people, those are optometrists. I just went and stood in line and waited for the shuttle bus. We're kind of nerdy people. And in fact, we're so nerdy, this is what we do for fun at home, all right? Go ahead. Somebody gonna comment about the socks and sandals? No? Nothing? Not come on.
Just say,
Yeah, so, right? So,
at least they're not white socks.
this is my dog, Oakley. She's the best dog ever, right? She's so docile and so passive. I have, this is a handheld autorefractor. So for those of you who've been to the eye doctor, you have a computer that kind of spits out what your prescription is. So I thought I gotta go home and try this out also. All right, she just sat there and boom, I got some readings, and she doesn't need glasses. Her eyesight's very, very good. All right. I have some contact lenses here to just kind of pass around. Many of you wear contact lenses, like you've seen them, maybe you haven't. They come in colors, they come in clear. You know, a contact lens is really a cool tool. You can take somebody that has really, really, really thick glasses and put a contact lens on the eye and you won't even know they have a vision problem. So there's a lot of people that wear contact lenses, approximately 30 million in the US. And a big part of my day is fitting a lot of different types of contact lenses. It's a lot of fun. I think, you know, if I have a 12-year-old girl who's quite introverted and conscious about her looks, wearing these really big, thick glasses, it's very, very rewarding to put some contact lenses on and have them come back a week later to see how they got this big smile on, they're starting to wear some makeup. You know, it can be very life-changing for a lot of people. I have 19 employees, and I rely on them for a lot of different things. I have about 6 technicians like this who spend probably more time with the patients than I do. They're doing a lot of the pre-testing, they're taking a good health history, and they're preparing them so that when I walk in the room, I'm ready to see them. Most of the technicians just get on-the-job training. There is some training for this. There's the Madison Area Technical College in Madison does offer it, but most of them are trained on the job. What do you see here, guys?
Red.
Foreign body. Some hot girl in a swimsuit from France? No, that's not foreign body. There's something on the eye here, right? This little piece of metal with some rust. All right? This was Mr. Richards before he decided he needed to wear safety glasses, working on his car and got a little piece of metal in his eye, right? So that stuff happens, and it's, if you've never had something in your eye, it's quite uncomfortable. So these patients will come in, and myself or Dr. Chloe will see them. We put a little anesthetic in the eye, they immediately feel better, and then we'll take a tool, looks like a little golf club, and just kind of pick that out of there. And then we'll take like a high-speed drill and just kind of grind the rust out of there. I know, you're just going, what? But it's actually pretty easy to do with the right patient. You know, most people just sit there and just kind of let you do it, 'cause they don't feel anything. But I'll see, you know, several of those in a month. Sometimes they go in streaks, we'll see 3 in a day, you just never know. Something like this is not that big of a deal if it's here, because it's going to leave a little bit of a residual scar. But if it's central, no matter how good I am at removing this thing, they're going to have a little bit of a scar. And so when they look out, it's going to affect their vision just a little bit. Let's try this again. Sometimes if somebody has an injury, we'll patch the eye afterwards. We do this a little bit less now because we can put actually a bandage contact lens on the eye. Another example of some trauma. Again, there's a lot to assess here. You can see a broken blood vessel, no big deal. You can see the patient's black and blue, right? No big deal. I had a lady, 17-year-old Wausau West student, 6 months ago, got hit in the face with a volleyball, right? She told me that she could see a triangle in her eye. And she was very specific about it. And I thought, that's interesting. So we're going to look at the back of the eye, and the shock waves from the volleyball traveled through to the back of the eye and actually bruised the retina in the shape of a triangle. So when she looked out, she could actually see this triangle. We actually got some pictures of it. I should put those on. And she's fine. A month later, it's gone, right? But she's going to be at risk for things like glaucoma and perhaps cataracts later on in life. So she'll have to be evaluated every year. Chances are she has nothing to worry about, but she's at much higher risk for having some problems later on in life. What are you looking at here? What's this picture of? Anybody? Okay. Here's your iris. Here's your pupil. Is the pupil supposed to look like that? No, it's normally round, right? This is the lens behind the pupil. That's supposed to be clear. All right? So this is an example of somebody who had some blunt force trauma. It tore their iris, so now their pupil is shaped like this, like a teardrop. And it's caused such a dense cataract that you can't even see into the eye.
So can they see?
No. So if the cataract's removed, depending on how much damage there is, the potential for good vision is actually pretty decent. But, oh my God, Chloe, you ever seen a cataract that bad? It's pretty rare. Usually somebody's gonna come in before it gets that bad. But it does happen. Yeah. Yeah, we were just talking about that an hour ago. People, I don't know, what's the word I want to put out? They do stupid stuff. We had somebody, Dr. Chloe was saying, people say, well, I ate some fried chicken this weekend. Is that gonna affect my glaucoma? And you're like, what are you talking about? You know, it's just people just ask the crazy stuff, yeah.
So when you get a concussion and your like vision is affected, like sensitivity and seeing things, is that your eyes being damaged or your brain?
Your brain. Yeah. So your eye, let's let the expert in ocular anatomy describe this to you. But so the optic nerve connects the eye to the brain, right, and vice versa. If your brain's damaged, it's going to affect how you see. Yeah. So if you have a pretty good concussion and you're having some symptoms like that, they usually go away, but it can take a couple of years. I'm doing a lot of veteran evaluation services exams, so I'm doing eye exams on veterans that had a service-connected disability, and a lot of them are the traumatic brain injuries from explosions. They're close enough to a device that goes off, and the concussion from that force doesn't damage their eye, but it damages their brain, and then they have some problems seeing. All right, so I've showed you a lot of pictures of the front of the eye, right? This is the inside of the eye. So think about this, your pupil is just an opening. We're looking through the pupil at the back of the eye, all right? So what do you guys see here that doesn't look normal? This is kind of hard if you're not an eye doctor. Okay? You see the bleeding on the left side of the screen? Yeah. So this is a patient that's diabetic, and they've got some bleeding inside their eye. Now, I can almost guarantee you this patient has no symptoms and 20/20 vision and just came in for what they call a routine eye exam. We looked inside, saw this. Why is that significant? The eye is the only place in the human body where you can look at the blood vessels. So think about that. If you want to look at the blood vessels somewhere else, they have to cut you open. So if this is happening inside the eye, it's also happening on the brain, the heart, the kidneys. So that's why if you have a systemic health condition like diabetes, you have to see an eye doctor on a regular basis, because you can actually look at the blood vessels and then communicate to the person's primary care doc what's going on. They might say, oh my gosh, we need to get this patient on a different medication because their diabetes is not under control. I see as many as 6 diabetic patients a day. So we spend a lot of time looking at the inside of the eye and counseling patients on what's going on.
So that's one thing, remember, if you guys recall from health, when we were in our first unit, the physical fitness and wellness, we talked about, I know I did, and I'm sure Mr. Richardson, we talked about the importance of getting your eye examined, because what's the big thing that is huge in your generation compared to mine and Mr. Richard and Mr. Sarazan?
Electronics.
Diabetics, right? I mean, I went to school, I went to school, folks, I told you, when I was, my first person I met was a diabetic. I was a junior in high school. I went to a football camp, and the kid bunking with me got up and he shot himself in the butt. I'm like, what the heck's going on? He goes, I'm a diabetic. There was no diabetics in our school during that time in the early 80s. All right, so it's a rarity. Now, when if we said, how many of you know a diabetic? Raise your hand. Probably this whole classroom raises their hand. So it's really important, and I go to Dr. Sarazan. In fact, I'm dual, I've got a schedule next week now that football's over. But to get my, just to get my eyes examined, just for purposes of that, you know, that's why, what do you suggest, how often should they be getting eye exams?
If you're in this room and you're healthy, and you're not wearing glasses or contact lenses, every 2 years is fine. Every 2 years is fine, all right? If you're in this room and you're wearing glasses or contact lenses, once a year. If you're in this room and you're diabetic, once a year. It's pretty simple. But otherwise, this group, if you don't have any vision problems and you're healthy, every 2 years is actually fine. You know, to put the diabetes numbers in perspective, people say numbers, you know, like, what does that mean? So there's 25 million diabetics. You're like, how many is that? Think about it this way, there's 30 million people that wear contact lenses. Well, you know a lot of people that wear contact lenses, right? There's just about as many people that are that diabetic in the United States. It's a lot. And like Mr. Kostreski said, it's growing. A lot. All right, this is something else we do on a regular basis. Dr. Chloe did one of these yesterday. How did I do on this one today, Doc? Did I pretty good? I got steady hands? Yeah. So this is a patient that's got some skin tags, and we just cauterize those. So they're there for 2 or 3 days, they turn black and fall off and they're gone. If you want Dr. Chloe to do some of these on you, just come in anytime, she'll do them. So, they're fun. All right, as optometrists, we counsel our patients regarding surgical and non-surgical options. We spend a lot of time talking to people about cataract surgery, LASIK surgery, what to expect during the procedure. We see them post-operatively after the surgeon's completed his procedure. We spend a lot of time talking to people about their occupations, their avocations, their lifestyle. Good example, if you are a 55-year-old plumber or electrician, so 55-year-olds can't see up close, right? That's why I got reading glasses on, that's why he's got those on, right? So if you're 55 or 60 years old, you have trouble seeing up close. If you're a plumber or an electrician, where are you working? Sometimes you're crawling underneath the sink. Electricians are trying to wire above their head. So where are bifocals usually in the glasses? In the bottom, right? Those don't work. You're trying to do this. So for those people in those occupations, we might put the bifocal on the top of the glasses. They work great. They're absolutely, so you do the both. You do one on the bottom, one on the top, and then you use the top one when you're working up here.
Yeah, that's hard, I stand on my head usually, so.
I gotta see that.
What's that?
Okay.
What do we do? Comprehensive examination of the internal, external eye structures. We test vision, determine treatments such as glasses, contact lenses. We treat eye diseases such as glaucoma and conjunctivitis, which you all know as pink eye. Nobody in this room has glaucoma, but chances are somebody in your family might. Diagnose, manage, refer systemic diseases such as hypertension and diabetes. We do pre and post-surgical care. We are seeing somebody at 2:30 today who just had cataract surgery. We'll see them for their first post-operative visit. We had one this morning as well. Preventative measures. Dr. Chloe, what do I tell every patient when I'm done?
Wear your sunglasses, eat your green leafy vegetables.
You got
See
it.
you once a year.
Yeah, so eat your green leafy vegetables, wear your sunglasses. We talk to people about just being healthy. If you're healthy, your eyes are gonna be healthy. Typical day. This is today. This is tomorrow. This is Thursday. We're doing some routine eye exams. We might have somebody come in with a piece of metal in their eye. We might see an infant. We might do 5 or 6 contact lens fits. I'm going to prescribe medicines for glaucoma. I might do a post-op care on somebody who had LASIK yesterday. I might prescribe a magnifying glass for somebody that's legally blind. Every day is a little bit different, which is great. It never gets boring. It's a lot of fun. I never noticed it, but either my son or my daughter pointed out to me that I go to work with a smile on my face every day. Just like these guys do. These guys love their job as well.
Good job, Dave.
Yeah, you gotta like your work. You only get to go through life once. You better enjoy what you're doing. Some days are kind of long. All right. Again, that's Oakley. He's a perfect dog. As an optometrist, you can specialize. You can go into pediatrics like Dr. Chloe. Give her a hard time about that. You guys know what pediatrics is. You can go into geriatrics. You can specialize in low vision. You can be a contact lens specialist. All of your patients are contact lenses, not just regular contact lenses like you guys wear, but specialty contact lenses for people with really, really bad eyes. Sports vision. There's an optometrist in Milwaukee, Chap Leffingwell. He is the optometrist for the Milwaukee Brewers. I think that'd be a good gig. You can be a vision therapy doctor. You can go into research. You can specialize in ocular disease. We don't see a lot of optometrists that specialize in smaller communities. It's generally going to be in the larger communities, perhaps Milwaukee or Madison or something like that. Because as a specialist, you're going to need referrals. And where do your referrals come from? Other eye doctors. So generally, you'll see optometrists specialize in larger communities. Yes?
What does vision therapy look like?
So vision therapy, again, is for mostly kids that have an eye turn. So if you got an eye that turns in, turns out, they're going to see you 3, 4, 5 times a year and recommend some eye exercises for you.
What does an eye exercise look like?
Yeah. So a good example was a kid we had yesterday. He had eyes that went like this. Dr. Chloe and I talked to him about simply taking a target like this and to work on crossing his eyes. Most of you can take something like this and do this, right? He couldn't. He got to about here and his eyes went, so he's going to work on that, try to work on crossing his eyes.
Is it just muscles or?
Yeah, just eye muscles. Yeah, good questions.
My nephew had, I'm not sure what it was, but they corrective lens in the one eye all the time.
Yeah.
And he's kind of to the point now that Jack's age, so he's 15, that he doesn't need his corrective
Is
lens.
that right?
But it was up until 2 years ago, he was still wearing, that one lens was totally different from the other because he had that, eye was off to the side.
He wasn't premature or anything, just?
No, they were twins, so he was the smaller of the twins.
Yeah, it's tough for kids if they have one lens that's really thick and one that's not, it's such an imbalance. Practice opportunities. Private practice, that's what I'm in right now, I'm in a group. I work with 2 other optometrists. I've actually worked in multiple settings. Prior to that, I was in a corporate practice. Corporate practice would be like going to a Shopko or a Walmart or a Lens Crafters. Some optometrists work for the government or in public health. Some work in teaching institutions. One of my classmates graduated with me, never left. He stayed at the school. He's a teacher then. You can work in a hospital or a clinic, like a Marshall Clinic. You can go in the military. You can work in the ophthalmic industry, like you could work for one of the contact lens companies or one of the glasses companies. So there's a lot of different things you can do as an optometrist. Job outlook is excellent. Primarily because people are just living forever, you know, and people that are in their 70s and 80s have a lot of eye problems. And so that speaks well for this profession. These numbers are still really, really pretty current. I was looking at this last night, I was looking around online, and you know, there's just projected to be a lot of growth for optometry in general. It's a great career in healthcare. The pay is good. You're not going to get rich being an optometrist. Rich optometrists, they did something besides optometry. Okay, maybe they bought a trucking company, maybe they invested in something. You'll have a very, very excellent standard of living, but you won't be uber rich as an optometrist. The hiring outlook is good. It's relatively low stress. I will say most days are pretty peaceful. We take care of patients. It's very rewarding to go home. It's a good day. Stressful days for me, and Dr. Chloe spent enough time with me to know that she says, I'm never going to do private practice. It's managing employees. You know, I've got almost 20 people, and there's something that comes up every day. Then there's other things like, because we own the building, all of a sudden the roof's leaking, or there's, you know, power's out. Those are the things that cause stress, because those are things I can't control. It's not very physically demanding. Most optometrists have bad shoulders from working like this all day. But other than that, it's really not too physically demanding. This is key. You guys think about this over the next 30, 40 years. You want to have a good work-life balance, right? It's really, really, really important. That should be what drives you for the next 3 decades. Oops. We'll see if that goes away. And we get the satisfaction of helping others. That's really cool. I'd say 95% of the people that leave my office leave happy. There's a few that don't, because maybe they